Streaming live from the Paul and Catherine Ranke Memorial Studio, this is TV Free Baltimore. Support for TV Free Baltimore comes from viewers like you. Become a TV Free Baltimore member by visiting patreon.com/tvfreebaltimore.
You're watching Maryland Politics here on TV Free Baltimore.
Welcome to Maryland Politics. I'm your host, Jeremy Washington. Tonight, we have Matthew McBride, who is a senior health policy expert with 25 years in the field. He's here to discuss the COVID pandemic and its impact on the state. Please tell us a little bit about yourself.
Sure. I've been in healthcare policy for 25 years, and mainly on the state level and the federal level. I have direct experience with the Federal Pandemic Response Authority, which is Health and Human Services Office of the Assistant Secretary for Preparedness and Response. 4 years there where I wrote the H1N1 After Action Report, which accumulated all the knowledge of the federal government in pandemic response. I was also the point of contact for HHS during the 2014 Ebola response. So I know specifically how these pandemics are supposed to be responded to, because the individuals who are responding to, who are calling the shots for this pandemic, they basically taught me everything that they know. So here I am.
Wow, you have such a pedigree today.
Well, I've been around the block, and I have particularly that type of experience both in the hospital systems and with pandemic response to be able to see how much of what we've been told about the COVID pandemic isn't exactly as it seems.
Unfortunately, that might be the case. So let's get started with some of the questions.
Sure.
Would you mind? So would you care to explain your claim that the data isn't right, that they might have either overcounted or underrepresented certain data points?
Well, we're talking about a couple different things when we're talking about data. There's data fraud that has been obviously committed. Data fraud is, for example, when they switch from reporting deaths to reporting cases, that when you leave one particular data set and you switch to another so that you can promote the idea that the disaster is continuing when in fact it's not. Another example of data fraud is how the state of Maryland, the Department of Health, they changed their hospital occupancy rate data back, I think, about September to kind of hide the fact that the health workers, the physicians and the nurses, were quitting and being fired from Governor Hogan's vaccine mandate. Then you also have bad data being fed into the system from a COVID PCR test. From what I understand, the inventor of the test said it's not supposed to be used for diagnosis. The test is known to be overclocked and inaccurate. The CDC has admitted it cannot tell the difference between COVID and flu. You have other instances of just pure fantastical data fraud. For example, the most glaring example, which is going to go down in history, is the idea that flu disappeared in the fall of 2020, which is impossible. And people still they bought that lie. So yes, there has been obvious cases of data fraud, outright data fraud, where they've been switching their sources. And then you also have data fraud in that they know they are purposefully allowing bad data into the reporting system. So this whole thing, I mean, if you ask me how many people have actually died from COVID, I can't really tell you because the data is just that bad.
You were talking about how different healthcare professionals were being fired. I've been reading that different reports, and it's not ones related to infectious disease, such as doctors who work with foot injuries, rhinoplasty doctors who work with pregnancy. What's happening to these doctors, and how has the mandate affected them?
As you said, these healthcare workers are not necessarily health workers who are at risk. of being infected by COVID-19. If there were truly a problem, people wouldn't even be going to these doctors in the first place. We'd be sheltering. But there are two things in play with the vaccine mandates and health workers. First is the governor back in September or so, August or September, had mandated a vaccine, mandated the vaccine for the hospital systems. So now if you were a physician or a nurse who was not vaccinated, you could be legally fired for that. And so that happened. And then you can also, apart from the hospital systems, you can also have various private providers who can choose to implement a vaccine mandate policy on their own that's not from the state. So you may or may not have those individuals fired as well. But the fact is that people are being fired and they're not at risk for spreading anything, really. So it's really a crime.
And it is kind of heartbreaking that the mandate came quite a while before the SCOTUS case, and how they essentially said that anyone that is not a direct person-to-person healthcare doctor could be cannot be fired for this.
Well, what it is with them, what they were talking about, SCOTUS had they kept in the exception for healthcare workers. And the Medicare program already, about what's called a conditions of participation, allows hospitals to put various mandates in place, and the vaccine mandate's one of them. So by saying that the healthcare workers still fell under the mandate, the SCOTUS was actually upholding the law with regards to the Medicare program conditions of participation. So what SCOTUS did say was that there's no reason for, there's no legal authority for anyone outside of the healthcare system who is not a Medicare, Medicaid provider to be under this vaccine mandate.
And speaking of the vaccine, remember to talk with your doctor about your health decisions, simply because while you might write the policy, we can't make medical choices for you.
That's true. You're supposed to talk with your physicians, and that's part of the insanity surrounding this whole thing, is that we have government bureaucrats, people like me who are not physicians, who are not attending physicians, we don't treat patients, deciding, we need this mandate, we need this vaccine, we need everyone to take it even if they're not at risk. And that is it. The only people who are qualified to determine whether or not you should receive any medical treatment under the state and federal law is the patient and that patient's attending physician. They're it. You can't have CDC saying everyone has to wear a medical device like a mask. They're how? They do not have authority under the law, but yet they did it anyway, and our politicians simply ignored it, and so that's got to change.
Yes, I fully agree. Speaking of the vaccine, many people say that it came too late. Not that it was not effective, but simply a dollar short and a day late.
Yes. Now, apart from the entire issue as to whether or not it's effective, one of the core medical countermeasures of pandemic response is vaccines, being able to provide vaccines. Now, novel pandemic viruses spread in a particular way, in a particular bell-shaped curve that was described almost 200 years ago by William Farr, a physician in the UK who was observing smallpox cases. The people get infected, it reaches herd immunity, and then the number of infections goes down, and if you didn't die, you're immune to it. You caught it, you've been exposed, and you're immune. Now, you're supposed to have a vaccine ready, and the federal government knows this by the peak of that surge event. They call that the pandemic surge event. By the time it reaches that herd immunity peak, you're supposed to have that vaccine distributed to the public. Now, the peak of the actual COVID peak was in May of 2020, and the vaccine did not come until December of 2020. So even if the vaccine was 100% safe and effective, it was not out there in time to really prevent any deaths or injuries.
And that's a surprise, because I've heard that they very much rushed the production of this. They might have gone a little too fast for their own good.
Yes,
and
might have.
That is still a very widely debated thing.
Well, I don't think it's that debated, actually, because the VAERS, the Vaccine Adverse Events Reporting System, that is in place in the CDC, they have that data is there. The number of deaths, number of injuries is there within VAERS. It's just being ignored.
Yes. And you mentioned the CDC and the medical devices. Moving on, how effective do you believe a mask is? Do you feel, because a lot of people have said that they're facial decorations, other people have said that if you don't have an effective mask, other places won't let you in 10 feet.
Yes, this is the thing about masks.
Eat a place.
Remember at the very beginning, back in January of 2020, our Surgeon General, and whose name escapes me, Dr. Fauci, they both said masks do not work. In fact, Dr. Fauci went on 60 Minutes early February, late January of 2020, and he said, you don't want to wear a mask. It's not what it says. It's not what's going to protect you. And then he made a very interesting statement. He said, and plus, people touch them and then they touch their eyes, or they touch. If you are not trained to wear personal protective equipment, you are at high risk of self-infecting. And during the Ebola response, the last bit of guidance I worked on with the CDC was on how to prevent our own healthcare workers in the United States from self-infecting with Ebola. Because in Liberia, the healthcare workers were not properly trained. They were not using the proper PPE in the first place, and as they were working, they would absentmindedly touch their PPE and then touch their eyes or their nose or their mouth, one of the membranes, and boom, they got Ebola. So if anything, these masks were just working to get people sick. And they know this. Now, there are three different requirements for proper mask use for PPE. It has to be rated for the virus, for the specific virus. It has to be fit tested to the user and not leak air. And then you have to be trained to use it. So no, that was certainly not being done. And they know this stuff, and I know they know this stuff because they told me to write it down, and then they approved it as the official statement of the United States government.
Funny that you mentioned about like masks that seal well. Yeah. I remember in the military, the one reason why they have to be clean shaven is because of mask fitment.
Yeah, that's it, right.
And thinking about how a lot of people were just told to wear a mask, and I believe that they had zero training. They had a mask with Paw Patrol on it.
Paw Patrol, cloth masks, they don't work. They know they don't work, and you'll notice that now they're saying, you need an N95 mask. Well, N95 mask, as I recall back from the research that they had done up to H1N1, was that at best they are 40% effective. They might be that effective. But when you're dressed with like a bandito about to rob a steam train, people are wearing like do-rags around their faces. Again, I always say that it looks like they're trying to rob a steam train in 1880. It's not going to do anything. It's ridiculous.
And on the other topics of the pandemic, about some of the other waves such as Delta, Omicron, how has this really affected people, and what could be influenza versus actual COVID?
And now, remember I told you a couple minutes ago that all pandemics, all epidemics spread by what's called Farr's Law. It's a bell-shaped curve. And coronaviruses spread in a certain way, at a certain speed through the population. They have a certain infectivity. Influenza spreads in a certain way. You can take that rate of spread is called R0, which is the base reproduction number. It's simply the number of people one infected person can infect. You take the average, and you can figure out from the infectious rate exactly when it's going to peak. I was able to determine that the second COVID wave was just a flu strain. It was an average flu strain. The Delta was also just an average flu strain. It had met the surge profile of influenza, and Omicron was a slightly more infectious. It was about 20% more infectious than a flu strain. They were not spreading. Influenza spreads more slowly than coronaviruses do. And so they did not have that steep peak to them that you would expect as for a coronavirus. They were more gradual as you would expect for an influenza. This is a science, again, that's been around for 200 years. So when they say that, the science is changing, no, the only thing that's changing is a lie coming out of their mouth every week.
on the topic of the vaccine passport that they've been talking about, I believe it's Senate Bill
839. Yes.
839?
Yeah. Senate Bill 839, which is introduced by State Senators Rose Pepe and King, I believe. And I submitted the testimony for the hearing today, written testimony for it. And very bad idea. The bill says a voluntary vaccine passport to be introduced in the state and run by the Department of Health. Now we have to remember there are... the thing about vaccines and the thing about a vaccine passport is the state of Maryland claims that about 78% of all Marylanders are fully vaccinated. Now,
that's great news.
Well, yeah. I mean, if it's 100% effective, if the vaccine is 100% effective, now 78%, the herd immunity threshold for COVID-19, not a lot of people know this, and they really should. It's about 60%, 60 to 65%.
Well above that, right?
Exactly. See, you understand this, right?
Yes.
We are well above the vaccine. We're above that 65%. So if it's 100% effective, the vaccine, we don't need the passport. Now, the state of Maryland on coronavirus.maryland.gov is also saying that 40%, 39.17% of all COVID hospitalizations or all cases are among the vaccinated. Now we have a vaccine that's maybe 50% effective at that, because you have to remember people who are not sick with COVID or who aren't sick aren't getting tested. So that 39.17% is only those individuals who are sick enough to feel, hey, I need to go and get tested to the doctor. So it's higher than that 39-40%, which would mean that it's basically a guy shows up to some establishment with a vaccine passport, and even if his passport's completely up to date and valid, there's still a 50% chance that the guy could be infected anyway.
So flip a coin and you might be infected with COVID, or you might be healthy.
It is just an exercise in wasting money and bureaucracy. That's it. It's nothing.
So it's nothing. Absolutely not worth
It
your
will
time.
not do anything. Yeah, so and I expect they'll vote it down anyway. It's a very bad bill and sets a dangerous precedent.
Okay, and let's go back to masks on children and everything. I've been seeing a lot of Paw Patrol, Peppa Pig, SpongeBob's, and I'm looking at these masks, and these things are pretty thin, and kids are constantly taking them off. How effective has masking children and keeping them out of school for computer school actually been for our kids' health?
Well, from what I've heard from other professionals like the speech therapist, I think they've seen a 300% increase in speech pathology issues because children need to be able to read adults' lips to learn how to speak. And then we also have what I said earlier about the problem that the masks themselves are not rated, they're not fit tested, and these children aren't trained to use these things.
Of course not. I've seen kids...
It's a joke. It's a giant joke. And then the fact that also that the school children were being forced to wear these things when they would go home with no masks, run around in the neighborhood with their friends, not wearing any masks. Their parents were, their parents weren't wearing masks, but only the children were wearing masks in the school system, as if the public school system were the only vector of transmission of the virus. It was obvious. Some people might disagree with me, but personally, I think it was child abuse. They were being used as political pawns, and it's a disgrace, and we need to take steps to make sure that those people are punished and that this never happens again.
That's a very tall order, and I can definitely respect your opinion on that.
Mm-hmm. Thank you.
But in the closing, what's your opinion on the COVID-19 pandemic? And for health officials like yourself, how has this really affected everybody? Because you seem very impassionate about this, and it doesn't seem like you have a very high opinion.
No, COVID was an actual novel pandemic. It was a threat between about January of 2020. It peaked in May of 2020, and by about August of 2020, most of the population it had already run through the population, and it was gone. Again, this is an established science. Everything since the summer of 2020 has been a lie. It has been, flu disappeared. Who would believe that flu disappeared? So they were lying about this, trying for political power, to sell a vaccine, to get money, and lasting impact of it. I'm disgusted at how our health authorities in this nation use the fear of death on people to try to control them, to try to push a vaccine, and it's just disgusting. And like I said, these people need to be held accountable for that.
Oh, thank you for your time, Mr. McBride, and
Thank you.
Have a nice afternoon.
You too. Thanks.
Everyone, thank you for watching Maryland Politics. I'm your host, Jeremy Washington. Stay safe and tune in for our next episode. Don't forget to like, share, and subscribe, and make sure to follow us on social media. Thank you and have a great day.
You're watching Maryland Politics here on TV Free Baltimore.